Hi, Dr. Lacrone and team. This is Michelle Yeager with Henry Schein Orthodontics. I wanted to send over a quick clip. I'm going on maternity leave here soon, and I know you guys just recently purchased the Twin Force Bite Corrector. So I wanted to at least send you over a quick demo video on delivery of this appliance. Wanted to point out a few just kind of important notes. First off, we want to be in our finishing wire minimum of 1622 stainless steel. Most of our offices are up to about a 1925, but make sure it is stainless, minimum 1622. You want to follow your same protocols that you would with a Force's appliance. Be sure to cinch back behind your molars, wire tie your cuspids. Anything beyond that is really up to you. Something else to note, when you receive your appliance, you'll receive this Allen wrench. I would recommend cutting this down as short, maybe about a quarter to a half an inch. That way you'll just have a little more, you can maneuver a little easier within the mouth. Another thing I like to point out, you want to go in, what I've heard is easiest, because either end of this appliance is a swivel head. That'll help out with having more lateral excursion for the patient. But you want to go ahead and engage the appliance similarly to this when you go in. If you can do it single-handedly, that would be best, because you can use your other hand to move the cheek back, and I'll show you something else that's important. But when you engage that screw, back out the screw, but not all the way. So I'm going to go ahead and show you how I would do this. Back out the screw enough to where you're not losing it, and then hold it as one piece. And hopefully we can see this as best we can here, but this is going to go between the first molar bracket and your second bite here. And you're going to place it here. You'll use this hand to kind of move back the cheek, but the most important thing, you want to push, hold on, let's see here. You want to push, I know it's hard for you to see this, but push on this head here of the C-clamp. Push on it pretty hard so that you know you're getting that wire. This screw will be to the occlusal bite surface, and that's how you will go ahead and screw it in. But you want to be sure to push on this. There's even a little notch in it. What happens more often than not is that the C-clamp goes over the wire, and that wire almost gets crimped, and you will have a false lock, and it will pop off. So we don't want that to happen. So you'll go ahead and screw it. Once you screw it, give it a tight screw. You're not going to strip that screw. A lot of people are pretty gentle with it. And then as far as bonding the lower, you really don't need to go in engaged and do one-handed now that you have a little more control over it. But again, that screw is going to be on the occlusal bite surface, and you'll just fit it between the two brackets. We don't want to be up against one bracket or another, because we don't want to pop off brackets. And here my screw kind of came out, so I might not finish this for you. But be very careful with that extra screw. If you run into an issue where you lose it on the floor, let me know. I'll send you some replacements. But you would just go ahead, place this one on the lower. And it's easier to go ahead and do the upper first, is what I've heard. And be sure to really push on this here. Screw, and then you almost hear a click. And that's how we're going to place it. Couple other things to note. When you're measuring for what size, you only received two sizes. We only have two sizes. You're going to measure from the mesial side of this upper first molar bracket to the distal side of this lower cuspid bracket. That measurement, you will see if it's 29 millimeters or greater, you're going to use the standard size, and that's the one that's going to come in the 424-215 TI box. And if it's less than 29 millimeters, you're going to want to use the small size, which is the 424-216 Ti. So those are the two sizes. But if you have any questions, feel free to give me a call. I'd be happy to come out and show you this in the office, but at least wanted to give you a quick demo through a video so that you have that. All right, thanks for watching.